tract and genital system, the action of this CFTR gene is to secrete the chloride ion, but in the sweat gland, the main action is the absorption of the chloride ion from the sweat production. The mutation of this CFTR gene is the main problem in the cystic fibrosis. The mutation causes the decreased secretion of the chloride, bicarbonate, as well as the thiocyanate and the glutathione. This causes the increased mucus viscosity and causes the airway obstruction. And also the for this the clearance of the bacteria is not is impaired. The clearing of the bacteria is impaired, and the oxidative stress is also happened due to the decreased glutathione level. This vicious cycle going to be continued, and for that the airway remodeling happens. All the mutations are grouped into these six headings, six classes. In the first three classes are most dangerous, but in the fourth, fifth, and sixth most severe. In the cystic fibrosis type 1, the main problem is the CFTR protein is not produced. In CFTR 2, the CFTR protein is produced, but the CFTR protein is destroyed till it can misfolded and destroyed. In class 3, the main the defective channel regulation is there. In class 4, the CFTR gene is produced, but the main chloride function is not up to the mark. Conductance is less. In class 5, the reduced synthesis, the number of the CFTR protein is less. And in 6, the stability of the CFTR protein is less. The key points regarding the CFTR mutation, the severity according to the classes, the first 1, 2, and 3 are more severe, but the 4, 5, 6 are less severe, as there are some amount of the CFTR protein are still present. The overall most common type of the CFTR mutation is the F508 mutation. Caucasian. Delta. India 44%. India তো এটাই কিন্তু ওদের দেশে যেমন 70% কেসেস থাকে এখানে 90 to 44%. This is most common in the Ashkenazi Jews and Jews. Intestinal epithelial cells homozygous for the F508 deletion are the unresponsive to the secretory effect of the cholera toxin. CFTR mutation produces the apparently greater negative potential difference across the respiratory epithelium. This is also and the chromosome 11 and the chromosome 12 polymorphism may be related to the lung severity. Additionally, এগুলো মানে মিউটেশন থাকলে আমরা the pathology of the cystic fibrosis, the respiratory tract, the earliest lesion is the bronchiolitis, then the bronchitis happens. The goblet Still, hyperplasia and the submucosal gland hypertrophy become prominent pathological findings. Finally, bronchiectasis, subpleural blebs, and the emphysematous pleura can lead to the pneumothorax. The changes are lung changes are mostly in the upper lobe. And the secondary pulmonary hypertension is a long-standing complication. The PNS inflammation with the multiple nasal polyps is also seen. In other systems, the pancreatic acini and the ducts are distended in infants and get replaced by the fibrous tissue in most of the cases till adulthood. The involvement of the islets of Langerhans became evident from the second decade of life. Rest of the GIT show the minimal changes. The esophageal and the duodenal glands are often distended with mucus secretion. Focal biliary cirrhosis is also common in adults. The fatty liver stone containing the gallbladder is also seen. In more than 90% males, the epididymis, vas deferens, and seminal vesicles are obliterated or atretic. And the clinical presentation. In infant, the cyanopulmonary infection is most common. Mostly the infection is caused by the Staphylococcus aureus, Haemophilus influenzae, or even Pseudomonas. And this happened within the first 1 month of life. By the first birthday, 2/3 of the patients show the heterogeneous air trapping and bronchiectatic changes on the HSCT is seen in the 10% cases till the 1 year of age and 60% till 5 years of age. In the GI findings, the meconium ileus, malabsorption, and the failure to thrive also happen. Pancreatitis. In the others, the dehydration happen and the hyponatremic hypochloremia happen. And the alkalosis.
Metabolic alkalosis commonly find condition of metabolic alkalosis.
In the childhood, the cyanopulmonary infection, the sinusitis, nasal obstruction, nasal polyp, and ABPA can also happen. Increase the anteroposterior diameter of the chest, we can see. And the GIT, the DIOS, distal intestinal obstruction syndrome, intussusception, hepatic steatosis, biliary fibrosis, and the rectal prolapse. And the other in the renal, we can also see the renal calculi and the hyponatremic hypochloremic metabolic alkalosis. In adolescence and in the adulthood, the ABPA, hemoptysis, pneumothorax, respiratory failure, polyposis, anosmia, sinusitis. In GI tract, the intussusception, DIOS, the biliary fibrosis, cirrhosis, digestive tract cancer can also happen. And in adolescent male, and the delayed puberty and the osteoporosis is happening. The congenital absence of the bilateral vas deferens is also a prominent finding. Type 2. The diagnostic criteria: presence of typical clinical features, the respiratory, gastrointestinal, and the genitourinary systems as present, or the history of the cystic fibrosis in the siblings, or a positive newborn screening test. Plus, the two elevated sweat chloride concentration obtained on the two separate days, or the identification of the two CF mutation or abnormal nasal potential difference measurement. The diagnosis and assessment. The sweat chloride test. Sweat chloride using the pilocarpine iontophoresis, the collected sweat is tested for the fluoride content. The more than 60 milliequivalent is the positive. The from 30 to 50, the value is the borderline, and less than 30 is unlikely, that is the CF. The false positive results we can get in the atopic dermatitis, anorexia nervosa, adrenal insufficiency, and the autonomic dysfunction, ectodermal dysplasia, and the hypothyroidism, and in Klinefelter syndrome. The false negative test we can get in the when the sweat is diluted, protein energy malnutrition, edema, and the hyponatremia, insufficient sweat quality, and the CFTR mutation when the preserve of the sweat duct is the function of the sweat duct is preserved. Sweat duct the 150 microns. 36.
ম্যাক্রোডাক্ট সিস্টেম যেটা আমরা কেনার চেষ্টা করছি, ম্যাক্রোডাক্ট সিস্টেম আমরা যেটা কেনার চেষ্টা করছি 17 লাখ, তাতে পার টেস্ট উইল কস্ট 5000, much more precision to follow 50 miles. But when the diagnosis is very, very important for the parents, that this is a killing disease, maybe now, maybe in future, maybe next time, then it is worth effective, because we need to give them a definitive diagnosis.
What
if you have two sweat tests positive with symptoms, it is that only thing was যে তোমার জেনেটিক্স স্টাডি টাইমে যদি আমি প্রিনেটাল ডায়াগনোসিস চাই, তখন আমার আসবে যে আমাকে জেনেটিক্স স্টাডি থাকলে সেগুলো তার আগে what is important that we need to confirm, but the confirmatory test is the two sweat test. And sometimes in winter you cannot diagnose because there is no sweat. There is no sweat. I think it is work, and especially when you want to diagnose a cancer, and studies cost 20,000. So it is what, because you are giving a diagnosis which is almost equivalent to a cancer, or maybe like that. So you need to spend on
the cancer.
it is worse than cancer. It is worse than cancer.
We can diagnose this by the DNA testing. Most of the labs do the 3296 common CFTR mutation. That the pancreatic function is also the quantification of the elastase 1 activity, in the fresh stool sample is done for the pancreatic function test. The newborn screening, the most common method.
This is very easy. The machine so it's not accurate. Our history and doing the sweat test combined very mostly otherwise only on the sweat test. Very difficult.
Dried blood spot for the immunoreactive trypsinogen plus the limited DNA testing. The elevated IRT and single detected mutation are considered as a positive screening test.
The first 2 months of not all.
About 10 to 15% of infants with positive screen based on the single mutated CF will be found to be the CF. Most recently, development of the aquagenic ringing of the finger within 3 minutes of the putting hands in water has been suggested as a screening test.
Characteristic of what I'm seeing is those who are carriers, they are having also possibility.
Publication kind of trying to push this as a population-based screen method. তাদেরকে আমরা সলিড জন্য পিক আপ করবো, তাদেরকে আমরা টেস্টের জন্য পিক আপ করবো, জলে হাত ধুয়ে দেখো। হ্যাঁ, মানে র্যান্ডম ওরা ওপিডি থেকে স্ক্রিনের মতো করে করার চেষ্টা করছে পপুলেশন স্ক্রিন।
But I don't think it's very effective, and one should do it because doing an aquagenic screening will cause a lot of stress. Cause a lot of stress.
The treatment of the CF in the children includes the respiratory management, nutritional care, and the anticipation and the early diagnosis of the liver disease, diabetes, and other organ dysfunction. The respiratory management, first the airway clearance technique, the chest physiotherapy, and the mucolytic agent. Hypertonic saline, 7%. And the proper antibiotic therapy is to be needed for the আমরা ক্লক্সাফেলিন আমরা নেবুলাইজ আইভি দেব আইভি
চাপ বেশি কম না ওটা যে বাল্কন দিলে কত তো ভাবতে হবে পরে একটা বাল্কন দিলে শুরু করে বাল্কন এক্সারসাইজেশনে ওই ফ্যাক্টর কালচার রিপোর্টে অ্যান্টিবায়োটিক প্লাস দুটো সিউডোমোনাস কভারেজ রাখা আপনি যদি বাল্কন দিলে পজিটিভ আসলে আইসোলেট দেখলেন ফর অল দ্য সিএফ the বাল্কন দিলে নোটোরিয়াস স্পেনোটোমোনাস সার্ভার এজন্য চারটা ভালো আছে আর নিউক্লিয়াস কোন অ্যান্টিবায়োটিক নেবুলাইজ করতে হবে কিছু অ্যান্টিবায়োটিক ইউজ করতে দিলে ওটা হাইলাইট করে মার্কস চলে না তুমি এটা লিখতে চলে হ্যাঁ বল বলতে বল
আরেকটা the bronchodilator and the inhalation steroid therapy is also effective in some cases.
সেটা শুধু প্রোগ্রাম সেটা গভর্নেন্স সেটা আর সবসময় তো প্র্যাকটিক্যাল পয়েন্ট অফ ভিউ করে রাখি যখন it's not that the machine becomes bad. It is the size of the particle which is important. Whether machine এইটা দেওয়ার আগে সবসময় বিপরীত নেবুলাইজেশন তারপরে 50% ক্ষেত্রে তারপরে অ্যান্টিবায়োটিক তাহলে প্রশ্ন বঙ্গস কাছে ওরা বুঝতে পারবে so before you nebulize the child 50%
production করি নরমাল ইনডিউস করার জন্য
ওরা অনেক আছে এটা তো আন্ডারস্ট্যান্ড
so basically to directly nebulize the child antibiotic or hypertonic saline the bronchos the idea is to remove the filter because the body is bronchodilate they will keep the hypertonic saline or the antibiotic.
In nutritional management, we can increase the calorie intake of the patient, the supplement of the fat soluble vitamin and minerals is given. The daily extra salt intake is mandatory for the patient. The pancreatic enzyme supplement is also.
Do they need more doses of vitamin? That's all the vitamin. So capital bottom we will write even in Bengali which is always type policy in Bengali sometimes. Yeah, that is
whether we should give this
that's very difficult. It's not these are particular organization. Not all they are critically
maybe not quite there using IRT as a
what they are letting is that in pancreatic is good. Even there are no symptoms, but my question is first number one. And maybe my child has only the chest. Wow, maybe when the child is growing older. So do we need to even vitamin is the point. Pancreatic is like vitamin is
We can also
non-sensitive area, you bring it to sensitive area. See, there is bronchitis that area is more sensitive. Now, reflexes you're bringing it from the unsensitive protected area, create better area, and then you lock it up. You cannot bring it without any copying. So that's the thing. Anyway, any protected idea is that from the protected cavity, bring it to the area where it is sensitive areas, and then lock it. Not that you're being told to have to make it. It's not that.
We can also use the safety modulator. The research of the biochemical manipulation to improve the safety function is of great interest. A great success has been documented with the use of the medicine ivacaftor. This is the safety.
Depends on the mutations, what type of mutation. Very, very close. 5 a per year. 50 crores of rupees per year.
I think Europe and the NHS was like
Which is they are commercial.
এগুলো হসপিটালে স্পন্সর প্রসেস থেকে পাই ডিরেক্টলি দেওয়া
যেমন like like Anand had leptin therapy. After that, she has improved a lot. With Anand, I want to know your general knowledge. With Anand, but Anand can take care of this. So he has a leptin therapy. Leptin therapy is very, very possible.
Sorry, the medicines are approved for the use in the children above 6 years of age. The prognosis, sleep remains a life-limiting disorder. Although the survival was dramatically improved in the last few decades, the median life expectancy is now more than 40 years. The outcome are variable and they related to the safety mutation class and the modified gene, biological and the chemical exposure, disease management, and socio-economic status.
I will tell you something about my first day. Yeah, I was sitting in the office and there was a 12-year-old girl sitting there. And my boss had asked him to come to the doctor to special case or chronic patient. So